AIDS is the final and most serious stage of an HIV infection, with severely damaged immune systems. People with AIDS have very low counts of certain white blood cells and may have additional illnesses. HIV is a virus that weakens the immune system, while AIDS is a condition that can result from HIV infection. Without treatment, HIV infections progress to AIDS in about 10 years. Thanks to treatment, not everyone with HIV progresses to AIDS. But without treatment, almost all people living with HIV will advance to AIDS. HIV infects white blood cells of your immune system, called CD4 cells or helper T cells. It destroys CD4 cells, causing your white blood cell count to drop. This leaves you with an immune system that can't fight off infections, even those that wouldn't normally make you sick. HIV initially makes you feel sick with flu-like symptoms. Then it can hide in your body for a long time without causing noticeable symptoms. During that time, it slowly destroys your T cells. When your T cells get very low, or you begin to get certain illnesses that people with healthy immune systems don't get, HIV has progressed to AIDS. AIDS is caused by long-term, untreated HIV infection for approximately 10 years. HIV is a virus in the retrovirus family with RNA genetic material. Retroviruses have unique properties that allow them to transform their genomic material into DNA. The virus then integrates its DNA into the host cell chromosomes. After integration, the virus hijacks the cell machinery to continue replicating.
HIV has 3 stages: acute HIV, chronic stage, and AIDS. Acute HIV may cause flu-like symptoms a month or 2 after infection. Chronic stage means you can have HIV for many years without feeling sick. It's important to know that you can still spread HIV to others even if you feel well. AIDS is the most serious stage of HIV infection. In this stage, HIV has severely weakened your immune system. Opportunistic infections are much more likely to make you sick in the AIDS stage. You're more likely to get certain cancers when you have AIDS. These cancers and opportunistic infections together are called AIDS-defining illnesses.
HIV can be present without any symptoms, so it's important to get tested even if you feel well. Flu-like symptoms such as fever, chills, and fatigue may occur when first infected with HIV. Other symptoms of initial HIV infection include sore throat, muscle aches, and night sweats. Rash, swollen lymph nodes, and mouth sores are also common signs of early HIV infection. Initial signs of AIDS may be subtle, including fever, fatigue, and swollen lymph nodes. As the immune system weakens, more severe symptoms like chronic diarrhea and weight loss may appear. Persistent skin rashes and susceptibility to opportunistic infections are also signs of advanced AIDS. The advanced stages of AIDS also carry an increased risk of certain cancers. Recognizing these symptoms early is crucial for timely intervention and treatment.
AIDS can be transmitted through direct contact with bodily fluids such as blood, sperm, and breast milk. Unprotected sex is the leading cause of more than 80% of HIV infections worldwide. Sharing needles with an HIV-infected person is common among drug users. HIV infection can occur through direct contact with blood or lymph of an open wound. HIV can be transmitted from mother to child during pregnancy, childbirth, and breastfeeding. Transfusion with unscreened donor blood can lead to HIV infection.
HIV/AIDS diagnosis is crucial for timely treatment. There are 3 effective HIV diagnostic tests available. Antigen antibody tests are one of the quick diagnostic methods. Anti-HIV antibody tests are also widely used for diagnosis. Nucleic acid tests, ATs, are another quick diagnostic option.
Safe sex practices are crucial in preventing HIV transmission. Consistent and correct condom use is key. Consider pre-exposure prophylaxis (PrEP) for significantly lowering the risk of HIV infection. Regular testing is important. Early detection allows for timely medical intervention and reduces transmission risk. Know your partner's HIV status and communicate openly about sexual health. Comprehensive sexual education empowers individuals to make informed decisions about their sexual health. Challenge stigmas and misconceptions surrounding HIV/AIDS to create an inclusive and supportive environment. Avoid sharing needles or syringes, especially among individuals who use drugs. Access to clean needles and harm reduction programs can significantly reduce the risk of HIV transmission. Pregnant women with HIV should receive appropriate medical care and adhere to antiretroviral therapy to prevent transmitting the virus to their infants. Community support and engagement are crucial in combating the social and economic factors contributing to the spread of HIV/AIDS. Address substance abuse issues through education, counseling, and rehabilitation programs to reduce the likelihood of risky behaviors leading to HIV transmission.
Antiretroviral ART has revolutionized AIDS treatment. ART involves a combination of medications targeting HIV life cycle. It controls the virus and preserves immune function for healthier lives. The goal of ART is to reduce HIV in the blood to an undetectable level. Slowing HIV's weakening of the immune system is crucial for patients. Preventing HIV/AIDS requires a multifaceted approach that combines individual responsibility, education, and community engagement. By adopting safe sex practices, promoting awareness, and ensuring access to healthcare services, we can collectively work towards a world where HIV/AIDS is no longer a pervasive threat. It is not only a matter of personal well-being, but also a shared responsibility to create a healthier and more compassionate society. Together, we can empower individuals to take control of their sexual health and contribute to the global effort to end the HIV/AIDS epidemic.
Thank you for watching. Don't forget to subscribe to our channel for more educational videos on natural remedies and health tips.